How's it going, guys? So this is Dr. Specific Chiropractic. So in this video we're going to talk about TMJ and also bruxism, also known as grinding teeth at night. All right, so close in, sir. Let the viewers know about when you first noticed these problems.
Well, I have this problem for many years, but lately it's been getting worse because of the clenching and bruxism. I lost my last two teeth of my lower right side because of the clenching, and now it's it's flaring up more often. And of course, I also have an issue with my lumbar L4, L5, I think it is, and hopefully my case is workable.
Well, you keep in the right place, okay? All right, so now the next part is this, okay? I believe during consultation you mentioned about you've been seeing the dentist, they've been giving you mouth guards and everything else.
Correct, yeah.
Okay. Anything else in regards to that?
Besides the mouth guard, sometimes I gotta, it's a lot of money because sometimes it works, sometimes they just break. And I just decided that I had to do something besides the mouth guard because it's I think if we could fix the root of the cause, I might not have to even use mouth guard.
Okay, understood. And so you're saying, just to clear the view as well, so you've been grinding and clenching your teeth so hard that actually you broke two of your teeth.
I broke and the dentist couldn't save it.
Sorry to hear about that. And also that stress at work causes muscles tighten up and feel everything clenching.
Oh yes, when it's really tight, the pain goes from my neck and it goes like this, I guess, all the way to my eyes. And usually it's one side more than the other one. But when I'm like that, I have to take a lot of painkillers.
Understood. So basically, to the viewers, what he's talking about is a referral pain pattern coming from the trapezius muscles over here. That's what these are over here. So clearly something's being very unstable on this region of the spine, over here, and that's what's causing these muscles to fire up to try to stabilize the neck. Okay, because there is no neck brace. We have muscles over here, so these are firing to try to stabilize this. So something's really unstable here and upper back over here. And then we have to really take a look what's going on below it, because you mentioned you've been having low back pain since you were a kid. So let's take a look at the x-rays, see what's going on.
All right.
Whenever I hear about TMJ, that's one aspect of it, okay? And we're gonna clear it, and I can see over here, okay, with the x-ray, yeah, you're deviating towards that way. So yeah, that confirms there is a TMJ in there. But the next clue is bruxism. And you're grinding so hard to the point that you broke a tooth, right? So when I hear something like that, bruxism usually comes from an atlas rotation. That means the bone right over here, the very top, the first bone, okay, on our cervical spine, it went so forward and rotated on you that, well, we can't walk this way at all, okay? So something's rotated so much that it's forcing the nerves being irritated and causing the jaws to clench so much. Okay, so that's where the bruxism is coming from. Now it comes to the next part is, okay, what caused your head to rotate so much this way? Well, when we keep on tracing all the way straight down, okay, I would figure that, okay, there's got to be some kind of significant either external rotation of the pelvis here or a severe rotation of the sacrum itself. But I don't see that. It's very slight and subtle. What I do see is a lot of degenerative joint disease here, GAD. It's posterior and inferior wards. Now, if there was a potential sacral misalignment, if we do adjust this one, what it's going to do is it's going to push it forward, and this bone over here gets even more backwards and sick backwards and inferiors like this, like going backwards like this, and like that as well, irritating that nerve even more. So it's unlikely. However, if there is, then I'll be forced to not only adjust this one, but also adjust and address that one immediately right afterwards. Otherwise, that nerve is going to be irritated like this and you won't be happy with it. The other potential I see more of is, okay, most likely there's this right ilium over here. But concerning how slight the misalignment is, I believe, and it wouldn't surprise me if I do the examination, is that it might most likely come from this. So what I'm anticipating is a false positive ilium, pelvis problem. So due to this fellow over here, where the nerve is irritated is so much that the pelvis is no longer getting the proper command signals over here, and that's why it's sinking down like this way and deviating towards this way as well. All right. So once we start addressing this fellow over here, then everything will start disappearing. All right, and start re-leveling and center itself. Now when we start going upwards and we start to see all the rotational twists, I'm seeing a significant side slip over here. All right. Now what that means is that usually when a bone rotates over here, it rotates a slight bit, either to the left or to the right. But if there is significant rotation over here, okay, because we have these two bones over here that blocks it, in other words, no matter how much I rotate, I can't go full 360 degrees, right? So now if I keep on rotating, okay, it's gonna start leaving the disc a little bit, and it's so severe, it's gonna be like this. But again, there's a lock, can't go all the way. So that tells me that since I'm seeing that side slip over there, and it's tilted up like this, there has to be so much twisting all the way from down below that cause that. And therefore this rotation, and I'm still seeing it, see, there's a side slip starting from here, 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 and gets really bad here, 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 keeps on going up. And even the second dorsal over here, it starts side slipping over here. So this one, and it's also swollen over here, and also on posterior inferior wards, is something I'm going to take a closer look at as well. But what makes things even more interesting is that because this atlas over here is anterior, and there is a slight occiput, AS occiput misalignment this way, but again, I believe this is just compensating for the severe rotation happening everything down below it. So by looking not only three-dimensionally, but fourth-dimensionally in terms of timeline-wise, if there's an anteriority on there, over here, I'm looking for the first PR, and the most slightest one is this fourth cervical over here. Now this is supposed to be a nice curvature like this way, but no, what I'm seeing instead is that we're seeing a very severe inferiority tilt right there. Okay, but if we keep on down, going a little below it, and I see it here, there's a very slight inferiority on number 6. So that could help explain why things the way it did, is that this is actually more of a final stroke ortho camel's back. Is from here and down below it. So when this was not addressed, and the rotation is still twisting out so much, I'm sorry, the other way, it's rotating so much like that way, it went this way. Again, we can't keep on rotating the head over like 360 degrees. So therefore, this, as a final circuit breaker, it tripped. And to try to protect the brain as much as possible, because the brain stem and the spinal cord, it doesn't like being rotated, twisting so much to the point that it's gonna rip.
Yeah.
It doesn't like that. So that's why that circuit breaker tripped the way it did, and that started flipping out. And then that's why your body started manifesting the TMJ and also the bruxism and all that stuff. So now the more ground scheme of this thing is that most likely what we need to do is, I wouldn't be surprised, we need to address this one very deep to take a lot of the rotation out. This is gonna start calming this right hip down, okay? But in the future visit, I may need to address this to still try to take some rotation out, okay, for that one over here, and then try to take that side slip out of the way, side slip over here. Then we finally get after the 6 and the 4 over here, and then we finally get to the mandible, the TMJ itself. All right, that's what the story is.
All right.
Now let's start piecing everything all together, guys. So we're talking about the history is the bruxism, the deep grinding, bad enough they broke the 2 teeth over there. And we can see here, look at it in terms of visualization, look at this. His traps is very spastic and tight on the right side. Even his left side is so spastic and tight. So everything, because of that 4th and the 6th cervicals are so inferior and so misaligned, is trying to stabilize this. It's basically like a weed that's like moving all around instead of being nice and stable over here. No, everything's moving so much. These things over here is like locking everything up to try to stabilize this fellow over here. We still have a lot of swelling over here, and I won't be surprised for that second dorsal over here. Okay. Yeah, this is chronic, been there for so long. We got this pitting edema at number 6, right there. Yeah, see, quite a bit of muscle spasm on the QLs over here. Okay. Yeah, some swelling, some minor swelling down here. The iliums, but not too bad. but there's a very puffiness, so a lot of it, chronic edema at the 5th lumbar region right over here. So let's confirm all that data. So with this instrumentation device here, it's going to help identify some potential areas we're going to take a closer look at. Now, because it's chronic and been there for so long, okay, sometimes we have to tilt the scope to help identify these potential areas. See, that's what I figured. There's a very, very slight little reading, like 1 point to the right for there. That's what I thought. There's one reading over here. Yeah, they're now right at that 4th. See over here? The sacrum is moving just fine. This ilium is slightly fixated on the EX side. So he's also slightly fixated on the right. But that 5th lumbar, that's a brick wall. That's not moving whatsoever. This 6th dorsal here is no big surprise. We got that side slip. See, this is also not moving toward the 2nd dorsal. Ooh, Nelly, you feel that?
Yeah.
See, that's all that swelling. There's a huge knot right there, that 6th cervical. How's that, sir? Not fun, right?
No fun, yeah.
What about this one?
Same thing.
Same thing, right? That's that 4th cervical. So this helps identify and confirm what our hunches are. See, the atlas is moving decent. It is stuck in anterior on the right. See, we also confirm as well the occiput. It's also partially fixated as well. And I'm going to show you guys another thing. Go ahead, march in place. Oh, careful.
Where's my balance?
Okay, stop right there. So now, what I'm going to explain to you is this. Okay, for the delay motion test, normal, I want to see everything moving symmetrically like this. Now, as you guys saw, he's not moving too well on this right ilium over here. So now, I'm going to show you this next trick over here. Okay. All right, sir, what I want you to do is this. I want you to lean back until you lean back. Everything, put all your pressure on your weight, on my thumb, right there, go ahead. Now, I only want you to lift only your right.
My right?
Yeah, only your right leg.
I know that.
Okay, go ahead. March. Go ahead. Try again. No, just the right.
Oh, just the right, okay.
So now, keep on going. So now the difference is this, okay? See what's going on to my thumb? It's actually moving even more. Okay, so let go. So what's going on is this, because he pushed some of his weight bearing onto my thumb and I pushed it forward as well, I'm taking some of that pressure off of that nerve, where we saw on the x-ray, he was like this. So by putting my thumb over here and he's leaning back, we just nudge a little forward. I'm not saying we're correct all the way. We're just like, we're giving a little space to that nerve over there and allow some more nerve function into this right hip over here. So therefore, that's why you're seeing what you just saw right there, is that this right hip will start to move a little bit more. So that gives even more information. Let us know that, no, this is actually a false positive pelvis problem over here. So I'm not going to adjust this right ilium over here. It's actually this 5th lumbar. This is the one we really need to address. Drop the butt, little more. Okay, breathe. Okay, coming up, sir. Walk around.
All right.
Come back, sir. Tell me, what's different?
My lower back is just different.
Oh, you tell me. What do you notice that's different?
I feel a little bit more, I don't want to say loose, but
Okay, that's a good start.
yeah.
Okay, how about the next question then? Okay, go ahead, give it a try with your jaw.
open it?
Yeah, sure. Open and close. How's your TMJ? And your neck? What's different in there?
The neck is better. I don't know how. It's kind of weird.
Well, how much better is the neck right now?
It's
From 0 to 100%. How much of a difference you notice right now for your neck?
I would say that it's like 40%, somehow more, I don't want to say stable, but not so stiffy.
As we explained before, we address the root cause of your problem all from down below, and then your whole spine starts to unravel from the ground upwards. So by addressing that root cause, that's already 40% right there. Any difference you notice in the jaw right now, your TMJ?
Okay, I don't want to say the pain is gone, but it's
A little bit less, right?
it's less.
How much less would you say?
Well, it was bothering me a lot here, you know, the like a something like pinching.
And now?
It's better.
How much better would you say?
Maybe like 40% also.
All right.
That part I don't understand because
Well, like I said, we're twisting everything. So when we start to take the rotation out of your head, it alleviates the pressure off the nerves. It calms down the TMJ. Okay, let's get the rest of it.
interesting.
It is, isn't it?
Yeah, that crack was kind of scary.
Well, the adjustment is kind of, deep, and it can be frightening for those, for some people over here. But like I said, that's why it's very important to see things, in fourth dimension, okay? We have to see the timeline, just like a chess grandmaster, okay? I need to see 10, 15 wizard of hands, and I need to see how this is affecting this, to finally get to your TNJ, right? No, drop the belly. Put it over here. No, relax shoulders. No more. No. No. No more. Great job. Coming up, sir. Okay, walk around, sir. Oh, that's a nice surprise. Smile right there. Tell us what's different.
It's more, I would say it's more loose. Yeah. I don't feel this click every time that I was moving my neck left to right. Or in the rotation, I would feel like click, click, like something was.
Good sign, because clicking usually means the ligaments are unstable and they have a hard time holding them both together. But because we realign the structures in your spine over there, the more stable it becomes, less clicking occurs. So okay, try the jaw. How's the jaw?
The one thing that I noticed right away is that when I will wake up in the morning, and then through the day. I will feel like when I close my teeth, I will feel like, they're not in, they're not in alignment, especially this side. When you notice now when you go to the dentist and sometimes you get they fix your tooth and then they have to make sure that the whole thing is in place so you don't feel like weird when you chew or,
Yeah, aligned.
Yeah. Right now, I just stopped feeling that, like my tooth was a little bit, how can I say, higher or, they were, especially the last tooth.
So now it feels more aligned?
Now it feels like, I was feeling that my last tooth was like a little bit higher. I was like, what the hell? I was like, what's going on? I thought that the tooth was coming up. Yeah.
And now there's a more proper space.
Now it's, yeah.
Nice. Okay, let's get to the TMJ itself. Okay, open, close, open, close. Okay, there's a lot we need to work on this fellow. Open, close. Okay. Open, close, open, close, open, close, open, close, open, close, open, close, open, close. Do a little more work. Open, close. No, slowly close. Open, close. Open, close. Open, close, slowly. Open, close. Open, close. Open, close. Open, close. Okay, stand up. Okay, now I'll give that jaw a try.
Better.
What's different about it?
It's more relaxed.
That's a good start. How much more relaxed would you say from before?
I would like at least 50%.
Yeah, that's a good start. Okay.
Yeah, yeah.
So this is what your homework's going to be, my friend. Okay.
All right.
It's actually all these problems that I mentioned before. Okay, it's for the neck, the upper back, mid back, and the low back. That cause everything to twist up and cause your TMJ to just twist now out of alignment. So on the following visit, let us know how your bruxism, the grinding teeth of the night, how that's coming about.
All right.
All right, and then we'll see you next time.
Thank you, doctor.
Oh, you're very welcome.
Appreciate that. Thank you.
You're welcome.